authorization, it's going to be available to treat COVID-19 patients. Convalescent plasma, blood plasma taken from those who have already been afflicted with and overcome the coronavirus. Those Americans who have beaten the virus are being urged to actually phone the government and donate more plasma so that it can be made available to their fellow Americans who are still suffering. We want to bring into the discussion Dr. Kanta Ahmed, a pulmonologist at New York University Langone Medical Center. Dr. Ahmed, it's my understanding that you've actually used plasma already in treating some of your patients.
That's right. And in fact, I was very thrilled to see this press conference. I was able to give it to one of my first patients in the pandemic early this spring. When it was extremely difficult to get hold of, and it was an experimental agent. It took me about 16 hours to get the infusion and then see the effect. So first of all, the president has to be commended for accelerating access, approvals, and the widespread availability of these agents. We've been using convalescent plasma for over 100 years for diseases like scarlet fever, diphtheria, one of the first. Most recently, when we faced the Ebola pandemic here, this was one of our approaches. As a rich country with a prime, really superlative healthcare system, we're not used to using very broad treatments like plasma. We're used to using targeted drugs. But we are so early in this pandemic that we must make use of all strategies. This is giving somebody, when they're in the storm, the eye of the storm of this disease, a huge boost. And I absolutely agree with the words of the FDA chairman that a 35% improvement in survival makes huge differences when at the beginning of the pandemic, we were seeing an overwhelmingly high rate of deaths. So this has to be commended. Every patient that comes to see me now in the office, often they're outpatients, they've recovered. When they tell me they have antibodies, I tell them to go immediately and donate plasma. God forbid, if I was sick, I would take this myself.